Can you share a particularly memorable case where treating gum disease significantly changed a patient's life?
Oh, yeah. So a lady comes in complete pain, and I'm looking at the teeth, and she's convinced it's a tooth, and I'm looking around. I don't see any decay.
Hmm.
Usually, if it's like real bad pain, I see a big black spot on the X-ray, and it's right onto the nerve, like it's like pinching your nerve,
Yeah.
right? You know, I'll never pinch it, but it's like squeezing the nerve, and it hurts so bad, it
Hmm.
throbs, it aches. That's how she's feeling. I think, listen, I don't see any tooth or cavity, but what I do see, your gums are really swollen.
Oh,
Yeah, and I can't remember the last time she had a cleaning, maybe 2, 3 years. But that bacteria grew so quickly, her gums swelled up so tightly, it's almost like having a balloon,
hmm.
and it's not. It doesn't want to pop. Can you imagine the pressure of
Oh,
that? Like a pimple, it don't pop. It
yeah.
hurts, right?
Yeah, yeah, yeah.
That's what's going on with the gums. I said, here's what we have to do for in order to do the most logical place to start would be your gums. We're going to
Hmm.
do the least amount of possible, but we're going to start there because you definitely need it, and I'm pretty confident it's going to take care of that pain.
Yeah.
And guess what? She didn't like the answer. Then I showed her, my team showed her how much it was going to cost to take care of it.
Hmm.
She didn't like it even more.
Hmm.
But guess what happened?
She felt better, didn't she?
She did it anyway. She felt better, and she comes into this day thanking me. So you know what? I feel so great. Thank you so much. That's from not really believing what I was saying,
Hmm.
but even in that whole thing about the whole money, but that investment in herself, in her mouth, made the biggest difference. And it's not about the money. It's really about just what you value. And she valued being out of pain in her smile. And now she's living it up. And now, guess what she does? You think she misses, 3, 4, 5, 6, 7, 10 cleans in a given?
No?
No, she comes in every 4 months. I think that's every
That's
3 months.
good.
Yeah, and she's living again. She's feeling great.
Smiling a lot.
Smiling a lot, just feeling good. Comes in, yeah. I mean, she's no longer afraid of the dentist because she understands that no, we're going to help her out.
Hmm. And that kind of goes back to like the home care, like taking care of your like mouth and flossing and keeping up with your cleanings so you can prevent stuff like that.
Everybody knows what to do.
Hmm.
Everybody knows that soda and sweets causes cavities.
Yes.
Everybody knows you got to brush your teeth.
Hmm.
Everybody knows you have to floss your teeth. It's been beaten into us, and that information is correct.
Hmm.
The question comes down to is, do you want a healthy, confident, good-looking smile?
Yeah. Even though people know what to do, why do you think they're so like reluctant to like follow through?
No, people are reluctant. There's different reasons why. I think sometimes people think they can't afford it.
Hmm.
But what ends up happening is when you don't take care of maintain a sports car, right? The oil changes to rotate the tires, you don't maintain
Yeah.
it. And you go, and after 5 years, you go take it to the shop. They're like, gosh, you need a new transmission, engine, you need this and this and that. It costs you more money.
Yeah.
So I think there's a misconception about that.
Hmm.
Two, they hear all the bad stories about a dentist
Hmm.
office, from root canals to pulls and teeth, what have you. And the thing is that people need to realize that they only hear the bad stories from people who probably had not taken care of themselves to begin with.
Hmm.
Like who goes to the dentist and say, "Oh my gosh, this is the best dental visit ever. My teeth are clean. I feel so good." You don't go brag about it,
Yeah.
right? You don't go brag about a doctor, right?
Hmm.
So that's another thing. And I think another thing too is you got the convenience of life. Now people love their sweet tea in the South.
Yeah.
People love their Pepsi and Coke.
Hmm.
People love their sweets and donuts. I talked to one patient the other day, and talking about sweets and everything else. I said, well, somehow we got on the diet. I said, no, you can't have enough sweets. I said, oh my gosh. And I have a donut in the car, and I didn't purposely eat it. That way, coming in here, you know, you won't see anything.